It is my pleasure to welcome you to our next session, which will address a topic of great importance, the impact of childcare, accessibility of the workforce, and on maternal and child health. Please take a moment to review our disclosures, which can be found on your screen. We are fortunate to be joined by a panel of experts who will share their insights on these critical issues from their perspectives. Following their presentations, we will have an opportunity for a few questions. Allow me to introduce our first speaker, Matt Jewett. Matt returned to the role of Director of Health Policy at the Children's Action Alliance in March 2023, having previously worked in that role and as CAA's research associate from 2004 to 2013. He has led outreach campaigns that increased access in kids' care health insurance enrollment, overseeing grants for Mountain Park Health Center from 2013 to 2023. Matt managed up to $35 million a year in grant funds, including for construction on a new clinic. Matt was a member of the Creighton Elementary School District Governing Board in Phoenix for 6 years. He is a graduate of U of A, go Wildcats, has studied graduate level public health at A.T. Still University, and enjoys a good cup of tea. His growing vinyl collection and exploring his home state of Arizona and the world. Matt, we look forward to hearing from your perspective on this topic.
Yeah, want me to go, and then the introductions will introduce the
yes,
please.
Panel.
So thank you, and I know we all just said that we were going to sit, but I am not going to sit because I can't see the screen from here. Yeah, it is on. Can you hear me? Okay. Yeah. Can you hear me better now? Yes. Okay. First of all, I apologize if my voice is quivering. It's not that I'm nervous, it is that I'm shivering. And after having complained to everyone about how cold the building is, I actually remembered that the pilot light went off this morning in my water heater. So I have been cold all day, which I'm sure that me from 2 months ago would be very happy about. So as Katrina said, I am Matt Jewett. I am the Director of Health Policy at Children's Action Alliance. Children's Action Alliance is an independent voice for Arizona's children at the state capitol and in the community. We work to improve children's health, education, and security through information and action. We work in the areas of children's health, in the areas of child welfare, which would be what a lot of people know of as our foster care system and children who are in out-of-home placement. We also work in early childhood education and early learning, and we know that all of these are very connected. I happen to be in the health area, so I leaned on some colleagues a bit in the childcare area, but this was very interesting for me to think about what is the intersection between childcare and maternal and child health, especially I am, as someone, my pronouns are he, him. I have no human children. So this is not necessarily lived experience for me. We can go to the next slide. But I am a policy person, as you heard. And recently, the Arizona Rural Women's Health Network, which is part of the Arizona Alliance for Community Health Centers, did a community health needs assessment, and they interviewed rural women. And you can see the counties in the upper left. Santa Cruz was actually the largest. And you can see in the top middle, what are the top 3 overall health priorities for women living in rural communities. Actually, you probably can't see it if you are in the room, but childcare is the purple one in the upper left that says 30%. So it was one of the top 3 that came back in a health needs assessment among predominantly rural women. What are the top 3 overall health priorities for pregnant women living in rural communities in the upper right? So access to healthcare, followed by labor and delivery services, followed by childcare, mentioned by 36%. We can go to the next slide. So the United States of Care is a healthcare advocacy organization on the national level that put together a fact sheet on what employers can do for childcare in helping their employees. I will read on the left, there is a story from someone who is only identified as a Black woman from California. I thought about returning to work at 6 weeks because people were like, you can go back to work, but I was scared to leave my child. I actually resigned from my position and my employer understood because it was my first child and I was nervous to leave her with anyone, and to return to work seemed like it would have been traumatic for both of us. The fact sheet from the United States of Care talks about things employers can do, including providing comprehensive benefits such as robust health coverage, of course, extended paid parental leave, which if you've been around the conference today, you've heard the governor's office has helped make that a reality for many state employees now. Lactation support, childcare assistance. And then also we know from in the second bullet point, women who lack affordable, high quality childcare is actually a major reason for missing healthcare appointments for themselves and for their baby in the postpartum period, which leads to a cascading risk of postpartum depression and distress. Psychological stress caused by childcare accessibility challenges is one of the most prominent predictors of maternal depression and other adverse behavioral outcomes during the postpartum period. Next slide. So you may or may not know that the United States is actually an outlier around the world. All those countries in blue or purple are countries with national paid maternity programs. And this comes from our colleagues at the Arizona Center for Economic Progress, which is the budgetary and economic policy, the fiscal and economic policy arm of Children's Action Alliance. So the United States remains behind with only those countries that you mention as the only 7 countries in the world without paid parental leave. Next slide. This is a video which I don't think we have the ability to play. If we don't, it's fine. We can, if there's a way of sending it out later, but ooh, we might. I don't know if this is going to take up my whole 7 minutes. It's a 3-minute video, so it should not. Come on, YouTube, come on. Do we have sound? They might not have sound on.
This is higher protection.
Okay, it will get sent out. So we can go to the next slide once we get back to the slides, but it is about paid leave. Okay, next slide, thank you. So the United States, as you saw, is an outlier in not providing paid parental leave. And when looking at a few studies, some things that stood out, paid and longer maternity leave tends to be associated with a reduction of postpartum depression symptoms in high income countries. And this one was, the first statistic was not as shocking, just 16% of US workers have paid parental leave. It's that as many as 23% of employed mothers return to work within 10 days of giving birth for financial reasons. If we want to be a country and a society that believes in equality or equity or opportunity for all, I think about those who are starting life under those conditions where the important bonding period is something that is taken away because of, and not accessible for people because of economic reasons. And finally, paid maternity leave is associated with improvement in postpartum maternal depression and intimate partner violence, infant mortality, pediatric visits, and breastfeeding. In other words, we keep hearing about how the United States has the highest rate of maternal mortality in the industrial world, and we are also an outlier when it comes to paid parental leave, and I don't think those are coincidental. We can go to the next slide. Also wanted to talk about how childcare itself can promote health and safety for children. The majority of children in our state, I was reminded, are actually in family, friend, and neighbor care. However, childcare centers have a number of health requirements that they're required to meet. And also they may participate in the food program from the Arizona Department of Education, which has nutrition. We can go to the next slide, nutrition standards. Head Start is required to connect children to primary and preventive care, including healthcare providers and dental providers. And also when I was at Mountain Park Health Center, Southwest Human Development Head Start sent their pregnant patients to us through a grant. So I've seen that in action. Next slide. So ultimately, childcare is an important social determinant of health, and I think we need to remember that. I think that is my final slide. All right, thank you.
Thank you, Matt. Our next speakers are Joe Barber and Dylan Fry. Joe Barba is a skilled public affairs professional with over a decade of experience navigating the intersection of government, business, and community engagement. As the Senior Director of Government Affairs at First Things First, Arizona's Early Childhood Agency, Joe spearheads the organization's government affairs and strategic advocacy initiatives working to shape and influence policies and programs that directly impact early childhood development and education across the state. Dylan Fry serves as the government affairs specialist at First Things First, where he leverages over 5 years of public policy experience to drive impactful advocacy efforts. With a focus on data-driven solutions, he focuses on synthesizing information to enhance government processes. Dylan has lived in Arizona for 25 years and holds a bachelor's degree in political science and a master's degree in integrative social science from ASU. Go Devils. I know, I like both of them. Equipping him with a robust foundation to navigate complex policy landscapes and to contribute to meaningful change. Joe and Dylan, the floor is yours.
Thank you very much. Hello, everybody. Good afternoon. I was really hoping they'd keep the chocolate-covered strawberries and the cheesecakes in here, right? So we'll go ahead and get started with the first slide, please. So, today, and I think throughout the day, you've heard a lot about the need for policy change, and that's been brought up in a couple of the sessions. And so today we're going to talk about how you can get engaged, right? How you can get engaged with your elected officials. What does advocacy look like? I think the word advocacy can be daunting at times, and it could be something that we, can say we sometimes think it's not for me, right? But advocacy is for everyone, whether you're having a conversation with your elected official or you're having a conversation with your friends, family, and neighbors. So we'll talk a little bit about that today. So some of the objectives we want to cover with you today is how to find your legislator. What does that look like in having conversations with those elected officials, understanding how a bill becomes a law. I think at some point Dylan might sing "I Am a Bill" from Schoolhouse Rock. And then understanding the various forms of advocacy, and then finally reviewing the best practices for engaging with your local elected official. So next slide, please.
All right, so how do I find my legislator? So you're gonna go to azleg.gov. Are we able to go there real quick? All right, so if you don't know who your legislator is, you're going to click on, go ahead and click on the Senate tab, just for simplicity. And then we'll click on members. Go ahead to click on Find My Legislator. So if you don't know your legislator, you're gonna click on the Find My Legislator page. And there's some instructions there. So click on the second link there. Yes. We'll give it a minute to load, but once it loads up, it should load in a map and you can put in your address and you should be able to find who your legislator is based on that.
And I just want to kind of explain why this step is so important. I think, your legislator, and we have the pleasure of having one of our early childhood champions in the room with us, Representative Lagore. Thank you so much for being here. But your legislators want to hear from you. They want to know what are some of the challenges that you're facing in your communities. And so making sure that you know who your two House members are, who your senator is super important. And we'll talk about ways you can engage with those elected officials. So as Dylan mentioned, here's where this is a website, easy to navigate, and how you can find that elected official.
Yeah, and so we'll go to the next slide. All right, so how does a bill become law? I'm not going to sing because I respect your willingness to wanting to continue hearing. But this is just a really general outline of how a bill becomes law. So a bill is introduced in either the House or the Senate, depending on which chamber it is. It'll be referred to different committees. Typically, they'll try and keep the committee to the same subject. So for Joe and I's interest, we mostly focus on the Health and Human Services Committee, the Education Committee, and the Appropriations Committee. Next, the bills are considered in committee. If they pass, they will be sent to the Rules Committee to make sure that the bill is constitutional and in proper form. Once the bill has passed through Rules Committee and been deemed constitutional, it'll go to both caucuses for both parties to sort of look at the bill and get an idea of how they're going to vote. Next, once it passes out of caucus, it'll go to Committee of the Whole, or what we call COW. This is the time for legislators to offer any additional amendments they would like and to further kind of explain their vote on the bill. Once it passes out of COW, it'll go to a roll call vote, which was the typical what you see in movies, like the senator from Maryland voted aye or nay. Once it passes out of the roll call vote, it'll then be transferred to the opposing chamber. So in this case, it would transfer to the Senate, and it'll go through the same process. And then there's also a pretty cool little drawing there with that at that link there. If you could click there real quick.
There we go.
So this is Arizona bill. I think this is better than me singing to you, but this is a pretty simplified version of how a bill becomes law. And this is available on the Ledge website.
Awesome. Okay. I just want to, talk about the importance of why we share this with you and kind of the steps on how a bill becomes a law. During that process, there's plenty of opportunities for anybody and everybody to get involved. If a bill is going through committee, there's a specific set of legislators who you should be talking to, the folks who are in that committee. You want to be able to, you want to encourage your friends, family, and neighbors to send emails to those elected officials in that committee and encourage them to either, vote in opposition or in support of that bill. So just wanted to mention that.
All right, so once a bill has made its way through both chambers, it's then going to be sent to the governor's desk, where the governor has three options. The governor can sign the bill into law, the governor can veto the bill, or the governor can simply just allow the law to pass. So there's three different options here. Let's go to the next slide. So this slide here is just to give you a visualization of how the legislature is currently made up. This is, of course, subject to change in, 12 days? So starting off, we have Governor Katie Hobbs, a Democrat. Moving on, we have Speaker Ben Toma and President Warren Peterson, both Republicans. You'll notice the red and blue dots underneath each of those pictures. Those are representative of the members in each chamber. So we have 31 House Republicans, we have 29 House Democrats, 16 Senate Republicans, and 14 Senate Democrats. And I included this slide to give you all a visualization of what a bill faces as it goes through its process. So you recall that we just touched on how a bill becomes law. This is important because in this current legislature, Republicans hold a simple majority. And what this means is they are able to send their bills straight to the governor's desk, regardless if the governor agrees on that policy or not. So this is, you may recall a couple years ago, the governor vetoed a number of bills, and the reason why was because Republicans held a simple majority at that point. They were able to send bills up that the governor necessarily didn't agree with, and so of course vetoed it. Let's go to the next slide.
Awesome. So we'll quickly talk about the types of advocacy that you can employ as you're having conversations with, or as you're advocating. So we have grassroots, media, digital, and direct. So let's talk a little bit about each. Next slide, please. So grassroots advocacy is one of my favorite forms of advocacy. It's just because I'm a talker, it's talking to your friends, family, and neighbors. A lot of the times we don't consider this advocacy, but when we're able to spread the message about what's happening in the early childhood space, what are the gaps, what are the challenges, this is a really powerful way to get folks to join the choir, right? Another opportunity to get involved is attending or hosting these community events. Recently, First Things First partnered with the Arizona Chamber to host a forum, or even events like this. But anywhere where we're having the conversation of what's happening, that way we can walk away just more informed and ready to kind of spread the message of what's happening in our respective work. So next slide. Media advocacy, this is a great opportunity, whether you're participating on radio, podcast, television, interviews. Encourage you to look at this forum for advocacy. We've seen on the headlines, we've seen in the headlines that childcare has been kind of a major issue rising to the top. So we've seen a lot of news segments on this. We encourage you to reach out to your news station to get involved and have a conversation with them about what's happening in your communities. Next slide. Digital advocacy, one of the easiest forms of getting involved. I know we've all had these updates today from our WOVA app, but Facebook, Instagram, Twitter, reposting, sharing, following what the fourth trimester is doing. I think even just posting and sharing what's happening today will help expand the network of what's happening in this space and help spread the message. So next slide. Direct advocacy. Now this is what, when people think about advocacy, this is kind of the most common way we think about it. We're sitting across the table from an elected official. So, we encourage you, reach out to your elected official. We talked about how you can reach out to them and set up those meetings. When you go through that process, you'll find their phone number, their email, their office number. So get a hold of them and get engaged with them. You can also attend the hearings, public hearings. You'll see bills go through the legislature pertaining to different issues in this space. So attending a public hearing and signing into the RTS system is powerful too, whether in opposition or support. Next slide. We'll skip because I think my time is running out. I already got the sign, but next slide. So what we want you to walk away with is that advocacy is about voice. Dylan and I spend a lot of time at the Arizona State Capitol, and there's not a lot of, birth to 5 children walking the hallways of the state legislature. And so we are that voice. It's up to us to go and represent the needs of children and their families at the state capitol. So I think that's it. Thank you.
Thank you, Joe and Dylan, for helping us understand how to engage in these issues. I'd now like to introduce Patrick Fitzhugh. Patrick is the Regional Site Director for USAA, where he supports the development and execution of regional strategies and supports 4,000 local employees while forging connections with the local community. His broad role includes the responsibilities of employee engagement, community development, public relations, sponsorships, DE&I, business continuation, and crisis management. His leadership abilities are deeply rooted in his military background in the United States Air Force. Thank you for your service. During his time in the USAF, he excelled as an elite survival, evasion, resistance, and escape SERE specialist from 2003 to 2007. He then dedicated his expertise to the Department of Defense, the Department of Army, and Joint Personnel Recovery Agency, becoming a subject matter expert in rescuing aircrew and soldiers in perilous situations. Patrick, we would love to hear about the innovative childcare solutions that USAA has developed to support parents and children. Could you tell us a little bit more?
Thank you, and thank you for having me here today. You can always tell really how the length of a introduction tells you a lot, I think. So I had a lengthy one for a reason. I don't work in the childcare space itself, but we do provide incredible, and I do believe world-class childcare benefits for our employees. If you don't know who USAA is, I don't have any slides, I'm sorry. You're gonna have to watch some TV or listen to some Pandora radio to hear about us. USAA, right? It's hard to get away from us. But we've been around for over 102 years. We are an organization started by a group of Army officers who could not find insurance in the public market. So they had to create a solution for themselves. And that's what I really love about the military community is really very often they have to create solutions for themselves and what their families need. So USA really has lived that model. Here in Phoenix for over 20 years, we've partnered with Bright Horizons, and on our property, we actually have a child development center. If you're not familiar with Bright Horizons, it's very similar to like a Montessori style school. They do have NACCE accreditation, so that's some of the highest level national accreditation that you can get. So it's incredible quality, and we have about 120 kids in our child development center. I was actually showing a picture to someone earlier this morning, was like, read across the nation or something, and I was in there reading to a bunch of 4-year-olds. It was great time. Some other benefits that we also offer, and I do want to say that I do think that these benefits are why USAA has such incredible employee retention. Like our employee retention metrics, our competitors or those who are in the industry would kill to have our employee retention metrics, and they wonder why. At the end of the day, we had a prior CEO, retired General Robles, and he said the customer or member experience will never be greater than your employee experience, right? So we know we need to take care of our employees so that they can service our mission. I'll just go through a couple other benefits, and then I'll kind of talk to you about scaling to this for employers who maybe you don't make a couple $2 billion a year like us, and but you still want to provide some solutions. So I think there's some middle ground. In addition to the Child Development Center, we also subsidize the cost of the child care for employees making underneath $60,000. So we'll step in and pay a percentage of that. We provide 60 hours of emergency backup child care at our Child Development Center. So employees can, you have to register with the program. You can't just raise your hand one day. You have to do some pre-work. And we have 60 hours of additional emergency backup child care at your home, should you need that as well. And that actually expanded this year. We now allow that for respite care as well. So if you're taking care of elderly at home and you need a break, you can get that. We offer flexible child spending accounts. I can tell you if you're a smaller employer, that is a very affordable approach and program to do. So a flexible spending account for childcare. We actually assign a health coach. So when you go into our health system and you look for resources, you can actually register and say, we're having a child. And that health coach will call you up within 24 hours and they walk you through each stage of pregnancy and help coach through health, mental health, and kind of all holistic components of childbirth. We do have 18, depending on how you do this, you can get 18 to 20 weeks of maternal leave. And we do have 12 weeks of paternal leave now as well. And as I was thinking about these benefits, and one other thing I'll just mention, this is like world class. No one's really doing this. And that's, we have an on-site health clinic with 8 offices with an RN. They prescribe acute medications, but families can actually bring their children over age 8 and to be seen same day at our clinic, and they can use it as a primary care. And so as I was kind of thinking about what to talk about, I remember my dad grew up in Southwest Arkansas, and whenever we visited once a year, they loved to take us through the old gas plant, which was just an empty field now with some old cement foundations. And they would, and this was before social media, so the kids are just kind of staring out the window, bored out of our mind, sweating in Arkansas. And he said, well, this is where we live. This is where we lived. And it didn't register with me till I was older that the gas plant itself built the house and paid for their housing. The gas plant built the school and paid for the teacher to come teach the kids at the school. And I think what we're seeing is we're going to see a larger return to employers having to step in and provide services that for a long time we've pushed back onto public services to provide. This isn't a new idea. Ford and GM, they did this. Mines across the United States have provided healthcare and childcare and education benefits near the mine construction because there's nothing out there. So what I would recommend to any employer who's in here or who might be listening or who you're talking to is, help them realize that they're going to have to take greater ownership of the services that their employees need. Now, that may mean that we're not able to provide the services, right? Hardly anyone can do what we've done because we've done it so long ago. But what you can do is you can be the connector. You can kind of take on the approach as the employer, and this is counterculture to large corporations, but take on kind of that case manager approach as a people leader and understanding what the individual needs are and what resources are out and available in the community. And chances are at most large corporations, if you ask a leader, a people leader, if your employee had trouble with transportation, who would you connect them with? What resources are available? They're not going to have any idea, more than likely. So as employers, what we need to make sure that we're communicating are, what are the available resources in the community? Heaven help, if I'm paying you $60,000, I hope you're not homeless, but guess what? There are people making $60,000 living out of their car at times, okay? So I think if you're going to spend the money one way or the other, you're either going to spend the money on retraining someone new, upskilling them, hoping that they stick around, versus spending the money on the benefit and creating a employee loyalty that is groundbreaking and that will take your business to new heights and new levels. So I'm not going to take up the full 5 minutes. I just want to talk a little bit about the art of the possible. If there's any company who's done it right and taking care with childcare, I think we're as good as you can do. But I think it just takes the heart of the employer to step into the unknown and start providing those services or educating themselves on how to connect their employees. So with that said, thank you for your time.
Thank you so much, Patrick, for sharing about the wonderful workforce policies at USAA. I'm sure a lot of us in this room are a little bit jealous right now.
USAAjobs.com.
And now I'd like to pose a question that one of our attendees posed in the actual app. And so number one, how can we enhance childcare accessibility to support the unique needs of Indigenous families while being inclusive of other backgrounds? Does anyone want to take that?
So at first things first, we have 28 regions across the state of Arizona. Some of those regions are made up of our tribal communities. And I think that there is a very intentional effort to ensure that there is adequate childcare and services available in those communities. And so we actually, within our team, we have Candida Hunter. And if anyone here has had the opportunity to work with her, she's my counterpart at the agency, but she does amazing work to ensure that the voices of the tribal communities are heard, are represented at our agency, and the needs are met. So a lot of good work happening there.
Yeah, I'll just add, and I do also another hat, corporate responsibility. So I manage our grant program here in Arizona as well. And we do work with the Navajo Reservation. We've done a program for the last couple of years where we've installed solar refrigeration units for their insulin for aging veterans because they have no electricity and they're dying from diabetes because they can't store their insulin. So that's what we're doing. And through this exercise, what I've learned a couple things. One, don't make assumptions that just because you've made it available that people are going to come to you and that they have an understanding of what you're bringing to them, right? We've really had to use the quote, we're bringing the mountain to Muhammad in this situation where we have to bring the resources and the service plans and the education to them and not expect them just by throwing a program and a label and saying, access the website here, call here, and you're going to get the support you need. You have to have boots on the ground in the reservation, and you have to build those trusted relationships. So much of how the tribes work, and especially with the government and the history behind the interactions between the tribe and the government, there's probably good cause for there to be some broken trust, right? And there's not, I hate to say it, but I've never met someone through Zoom who I wanted to hug, right? If that's our relationship, I'm not going to take a bullet for you more than likely. So there's not a substitute for you having feet on the ground in the community, showing up and investing in them. So that would be my thought on that question.
Thank you. That was very insightful. I have one more. 1 minute. Any other model company policies that support childcare access here in Arizona that anyone would like to touch on?
No, but I have a final question. Can we sing happy birthday to Joe Barba? That can be afterwards.
Yeah, we need to get off the Hoover app first.
I'll add one more thing. Partners don't have to be the Montessori Bright Horizons. Your partners can be the YMCA, the Boys and Girls Club, Big Brothers, Big Sisters. In San Antonio, I've had 4,000 employees here. In San Antonio, we have almost 20,000 employees. That's a lot of kids. So what we've done there is we developed a partnership with the YMCA. So for before and after school childcare and for pre-K and below.
I'm kind of curious, like, the case USA does to, from the economic case to show like hardcore numbers. And I'm thinking like, Matt, your presentation, like you show all the countries, but like I'm thinking like channeling the legislators are going to come down to the bottom line. What is it going to save us? Is there an economic study? Like, do you go to USA and say, what are the numbers to prove that? And what would it look like to ripple it out? But have there been micro examples to show that, the ROI?
We do have studies at First Things First, and if you look up our annual report, you'll be able to find that information. But I believe that the dollar amount is for every dollar the state invested, there's a $17 return. So it's pretty high. There's a high yield, and 16. So, utilizing those numbers to be able to make the case, obviously, is large ROI. I do also just want to mention something, just kind of on a final thought. The question that was raised earlier is this idea of talking to employers about the childcare crisis. I think a lot of the times we assume that they know that this is a challenge. They don't. We have had conversations with businesses across the state of Arizona, and when you talk about retention and recruitment, they don't see childcare as that barrier. But once you tell them, hey, once you put it on their radar, it's almost like they can't unsee it. You let them know, hey, have you thought about, does your community have adequate childcare? And it's kind of interesting that we're right, below the Arizona Commerce Authority offices, because, the CHIPS Act, they saw childcare as such a high, part of the ecosystem of these businesses coming to the state of Arizona that it was included in that language. So. Any other?
I think actually we're at time, but thank you all. Please join us again at 3:10 for our next session. I really do appreciate our wonderful speakers up here. And before you head out, I want to remind everyone to participate on the Hoover app, hosting leaderboard contests and a